Hello, everyone. My name is Stephen Lee, and a freshman here at the University of Utah. Today, I'll be talking about the effects of the COVID-19 pandemic on the lives of healthcare workers. Often going unnoticed, these issues caused by the pandemic play a major role in affecting the healthcare workers' overall well-being. First of all, I would like to talk about this quote shown on the slide. It is as stated, his sensibility was getting out of hand. Kept under all the time, it had grown hard and brittle, and seemed to snap completely now and then, leaving him pretty of his emotions. No resource was left to him but to tighten the stranglehold on his feelings, and harden his heart protectively, for he knew this was the only way of carrying on. In any case, he had few illusions left, and fatigue was robbing him of even these remaining few. This quote is from the novel The Plague by Albert Camus, which shows great similarities to the experiences of others during the COVID pandemic. The reasoning that I chose this quote is that it very accurately portrays what a healthcare worker might feel working in a hospital or clinic during a COVID pandemic. In the story, we meet Dr. Ryu, who is one of the main doctors during the deadly plague epidemic. This quote describes his experiences and struggles after combating this plague over a period of time. Healthcare workers are greatly affected by the daily struggles experienced fighting a threat like a plague or virus. The effects of the pandemic are talked about later in the presentation. Next up is the importance of stating my thesis statement. This thesis statement overall summarizes my main points. It is as stated. The mental challenges, physical decline in health, and discrimination from society caused by the COVID-19 pandemic significantly affects the overall well-being of healthcare workers across the world. In order to support this thesis, I interviewed a healthcare worker that worked in a hospital during the COVID-19 pandemic and connected what they said to researched evidence. Before I dive into the details, I would like to introduce my interviewee. Her name is Kelsey, and she currently works at a hospital in Utah as a CNA. Through her experience working through the pandemic, I was able to gain better insight into the life of a healthcare worker during the pandemic. Also, it is important to understand the background of some changes for healthcare workers, which gave them major obstacles to overcome. One of the first is the sudden rise of hospitalization of patients. Many hospitals and clinics lack the necessary equipment, manpower, and space to house all of these patients. In many parts of the world and the United States, ventilators were in such short supply, and for some hospitals, they had to turn patients away. Many strict safety guidelines were put in place due to the spread of the virus as well. Everyone was fearful about the virus. The fact that there was no particular cure and very little information about it overall. These factors and a number of others ones are significant in placing challenges and difficulties into the personal lives of these healthcare workers. One of the major challenges that typical healthcare workers face on a daily basis is the physical decline in health. One of the overlooked issues when it comes to physical health is the skin conditions. In a study, there is a strong correlation between increased hand sanitization and the appearance of skin conditions such as eczema or dermatitis. That is true as my interview with Kelsey. She stated that with constant washing and hand sanitizing, my hands are completely wrecked from it. They're always dry and peeling. In the photo shown on this slide, it shows the interviewee's hand, which we see as dry and may even be painful. The picture to the right of the hand shows what a healthcare worker sees on a daily basis: a sink, soap dispenser, and hand sanitizer dispenser. When surveying health workers, the common symptoms observed included dryness, burning pain, and vesicles, which are fluid-filled blisters. With an, with an increase in occurrence from 65.2% pre-pandemic to 73.6% during the pandemic. This statistic was from the Journal of Cosmetic Dermatology. An 8.4 difference in a span of less than 1 year is statistically worrying and requires a solution in order to remedy this issue. Although it may seem like such a minor issue, hands are an essential tool required for performing specific jobs. An example is surgeons and other surgical healthcare workers experience limitations that hinder their abilities to perform procedures with decreased efficiency and a high risk of mistakes. Skincare intervention is important as the pandemic becomes an everyday part of our lives. Many of these skin issues may become permanent or chronic, resulting in major losses of healthcare workers in the future. Within the community, healthcare workers experience even greater mental burdens than the average individual. Higher rates of anxiety, stress, depression, and some other psychological disorders are very common for those working in a medical profession. From 13 studies with a total of 33,062 individuals surveyed, the percentage at which workers presented anxiety symptoms was approximately 23.2%, with depression at um, 22.8% and insomnia at a high percentage of 38.9%. This was from the journal Brain, Behavior, and Immunity. Healthcare workers present much higher vulnerability when it comes to experiencing psychological challenges, which implies a greater need for interventions. The decline in mental health stems from a wide variety of reasons. Shown below are just a few: fear of infecting others or being infected themselves, being overworked, or maintaining strict safety guidelines. In the photo shown to the right is the empty hallways of the hospital the interviewee worked at. In order to maintain strict safety guidelines, they make sure the patients stay in their rooms, making sure they wear a mask when they leave the rooms, or not even allowing visitors to come in, and more. Alongside these, a number of stressors are evident in the environment healthcare workers work in. According to the medical journal Brain, Behavior, and Immunity, healthcare workers may experience increased proximity to those that are infected, but also experiencing increased workload, physical exhaustion, inadequate equipment, nosocomial transmission, and the need to make ethically difficult questions, which greatly contribute to the decline in mental health. A quote really stood out about this issue from the interviewee, Kelsey. She states, "It's mentally draining seeing patients in their worst conditions. I would also catch myself living these experiences." This quote shows great significance for a number of reasons. One of these reasons is that rather than leaving everything behind at work, healthcare workers like Kelsey also have events at work that continue to haunt them into their personal lives. These experiences contribute to even greater incidences of stress, anxiety, depression, and other mental struggles. Hospitals and clinics, as well as governments, need to form solutions to prevent the continued decline in mental health for healthcare workers. This could lead to a severe shortage of workers in the future. A major challenge that healthcare workers encounter too often due to the pandemic is the isolation and, for the most part, an exile from the rest of society. Due to healthcare workers' proximity to COVID-19 positive patients, they are stigmatized by many within the community, leading them to be pushed aside. According to the Journal of Anxiety Disorders, many individuals feel fearful towards others who are likely to contract the virus, resulting in exile and avoidance of certain individuals. According to the British Columbia Medical Journal, surveys of over 3,551 individuals reveal that 1 in 3 people agree that they will actively stay away from healthcare workers if they can. This brings to light a new form of inequality and disparity within the society that needs to be addressed promptly. The stigmatism towards healthcare workers can negatively affect their mental health and also lead to certain conditions shown in the previous slides. A shocking result from surveys showed that a quarter of participants believe individuals working within the healthcare field should be isolated from the rest of the community with restricted rights and freedoms. This is from the Journal of Anxiety Disorders. This is especially shocking. In a society that is constantly evolving for the better, there are still cases where people wish to inflict inequality on others. These fears stem from the myth that healthcare workers have significantly higher risk of spreading the virus, which is false. Statistics from the Columbia Medical Journal show that COVID-19 prevalence for healthcare workers is approximately 0.14%, compared to the 0.10% in the average individual. Although there is a difference, this difference of 0.04% should not be a significant factor as to why healthcare workers are feared. This behavior from others can affect the overall mindset of the healthcare worker learning them to actively isolate themselves due to the fear of others. According to Kelsey, she says, working in a healthcare setting, you don't want to be the person that makes other people sick. So basically, you're isolating yourself. And she also says, it gets really lonely, and yeah, you really want to talk to people, but it's best if you don't. Healthcare workers like Kelsey are forced to isolate themselves from the rest of society, which significantly affects their daily lives and health. They go to work and come back home, and in the end, they feel even lonelier than ever. This is pretty much what Kelsey goes through, she says. And so, coming home from work every day, I would immediately shower, change clothes, and go into my room the rest of the day. Evidence from number of studies also show that there is a correlation between stigmatisms of healthcare workers and stigmatism of other groups. From the Journal of Anxiety Disorders, they state that people tend to show dislike towards foreigners or individuals who are likely to those who exhibit any form of sickness, including the elderly or obese. Individuals who show stigmatization towards these groups typically show the same feelings towards healthcare workers, who are also known as HCWs. Overall, workers pose similar uh, levels of risk of infection from COVID-19 as the general public, and they shouldn't be seen as a foreign threat. In closing, the healthcare workers are constantly experiencing challenges in their lives, whether it is mentally, physically, or in the form of stigmatisms. Highlighting these issues encourages discussions toward providing support and better interventions, especially since these problems go unrecognized and ignored. Future studies and research should be conducted in order to truly understand the depth of damage and how to effectively handle it. And shown here is my works cited. Thank you for listening. I would like to thank you all for listening to what I had to say today. And I would also like to thank my interviewee, Kelsey, for providing me the perspective I needed to truly understand what working as a healthcare worker during the COVID-19 pandemic is like.